Answer our questions is Dr. Daniel Koritzkis, who's Chief of Infectious Diseases at Brigham and Women's Hospital. Dr. Koritzkis, good to see you.
Good to see you, Ben and Erica. Those are cute kids.
They absolutely are. So there are some people out there who say that kids have not been a big part of this pandemic, but how important in this fight to finally end this pandemic is this step of getting these 5 to 11-year-olds vaccinated?
I think it's become increasingly important. Last year, or at the beginning of the epidemic, it's true that most of the cases were in older adults. And that's partly because kids were essentially locked away at home. But now we're seeing that kids are really responsible for fueling the epidemic. 10% of cases across the country have occurred in young children. And here in Massachusetts, somewhere between 20 and 25% of cases are occurring in children and younger adolescents.
Okay, so it is important. Now that kids are getting their shots, Dr. Koritzkis, what should we expect to see in terms of any side effects, any reactions? What's normal?
So the side effects are pretty much the same as what we've seen in adults. I mean, kids can expect to have pain at the injection site. They're going to have an ouch there, but headache, some muscle aches and pains, low-grade fever. They're actually less common in children 5 to 11 than in older children.
All right, we know there are parents out there who still have concerns about this. I really don't think those numbers are very high here in New England. And then we know the FDA and the CDC have signed off on these shots. So based on the signs, what is your best argument to convince those parents that they should give these kids these shots?
I think there are a couple of things people should realize. First of all, the number of hospitalizations that we're seeing in children from COVID now is approaching what we see from flu in a bad flu year, and we vaccinate against flu. Also, there are actually more deaths from COVID per year in the last 2 years than what we used to see in terms of deaths from bacterial meningitis or German measles, illnesses that we now prevent by vaccination. We also want kids to be able to go and stay in school and to not bring disease home to vulnerable people in the household and to help protect their communities.
Yes. Well, and now kind of looking ahead, many families now in the midst of making travel plans because the holidays are coming up, something we really didn't do so much last year. So what should we all be thinking about in terms of precautions, even if everyone is vaccinated?
I think you should know where you're going. Make sure that the people you're going to be meeting with are vaccinated. Don't travel if you're sick, and be aware of whom you might be bringing something back to when you return. If there are vulnerable people in your household or in your community that you want to avoid bringing any COVID illness back to when you return from your travels.
Okay, but should be a nice feeling to celebrate with family. Vaccines are out there. Thank you, Dr. Koritzkis, as always.
You're very welcome.